very good afternoon, respected chairperson and dear audience. I am Dr. Ravi Kumar. My topic of presentation is study of the refractive changes and ocular biometric in preterm and term infants. My co-author is Dr. Suchita Paridas. He is additional professor at AIIMS Bhubaneswar. I have no financial interest. So preterm neonates born before 37 weeks are prone to various ocular problems like ROP, refractive error, strabismus, and amblyopia. Worldwide, 15 million neonates are born premature, and full-term healthy newborn is generally born with axial hyperopia, and preterm newborns are noted to have myopia, hyperopia, and astigmatism at birth, depending upon the gestational age and stage of ROP. Previous studies focused on ocular biometry after ocular stability age, that is 3 to 16 years, and information regarding refractive status in infants in whom dynamic ocular changes are ongoing are still limited. So the aim and objective of this study, the primary objective was to compare refractive changes in ocular biometric between preterm and term infants in Indian scenario, and the secondary objective were to compare the refractive outcome in preterm infants with ROP and without ROP, and to study the association of refractive error with the birth weight and gestational age. This is a cohort study incorporating 90 infants, 45 age-corrected preterm and 45 term. Inclusion criteria were preterm and term babies born at AIIMS Bhubaneswar between January 2019 till December 2019, and exclusion criteria were babies with systemic comorbidities like severe sepsis, hypoxic ischemic encephalopathy, or on mechanical ventilation, and ocular comorbidities like congenital cataract or corneal opacities, and syndromic babies were also excluded. In Group A, the age-corrected preterm babies were taken, and in Group B, the age-corrected the term baby were taken, and growth parameters and ocular parameters were recorded. In growth parameter, it were gestational age, birth weight, length, and hair circumference, and in ocular parameter, corneal diameter, cycloplasic retinoscopy, A scan, and fundus examination was done. The first follow-up was done at 3rd month, the second follow-up at 6th month, and the last follow-up was done at 12th month, and growth parameter, refractive error, and ocular biometrics were recorded at the follow-ups. Coming to the results, this is the table showing the baseline demographic distribution of infants, comparing between the preterm and term on the basis of gender, mode of delivery, number of twins or triplets, and socioeconomic status. There was no any significant difference between these two groups on the baseline. These are the two tables showing the refractive status of preterm and term infants at birth and 12 months. Here we can see that the preterm babies are more prone towards having myopia, whereas the term babies were more towards the hyperopia. And on comparing these two, at 12 months, the emmetropization was similar in both of them, and there was no any significant difference between the preterm and term babies. Coming to the secondary outcome, this is the pie chart showing the distribution of the ROP among preterm infants. And among 45 total preterm infants, 5 infants had ROP. The worst staging was zone 2, stage 2, and when independent t-test was conducted, it showed no difference between the ROP and no ROP with the p-value of 0.64 in our study. This is the plots showing the correlation between the mean spherical equivalent to the gestational age and the birth weight. Here we can see that the birth weight is strongly associated with the spherical equivalent more than the gestational age. This is the plot showing the comparison of the mean spherical equivalent and its increment within infancy. Here we can see that the preterm babies are initially deviated towards myopia, and then it went towards emmetropization, whereas the term from initially only they were emmetropizing smoothly. So coming to the discussion, Larson et al. And Saunders et al. Stated that among preterm and mild ROP or without ROP, there is myopic shift initially and delayed emmetropization, which was seen in our study. And Pennefather P. et al. Stated that there is no significant difference between the no ROP and stage 1 and 2 ROP. Varghese R. et al. Also found that the birth weight is more correlated to the final mean spherical equivalent than the gestational age, which is according to our study. Coming to the conclusion, preterm infants have tendency to develop myopia, whereas term infants hyperopia. There is no significant difference in emmetropization among preterm and term infants at the age of 12 months, and among gestational age, birth weight is more associated with the refractive status at 12 months. These are my references. Thank you. Thank you for your patience listening.